Kaylee at Station 1. Hi, my name is Kaylee. I'm going to be your student nurse. Can you verify your name and date of birth? Okay, just going to check your wristband. Okay, do you have any allergies? Okay, I'm going to close the privacy. I'm going to wash my hands. Okay, today I'm going to be giving you a subcutaneous injection. But before I do that, I'm going to show all the sites of where I would inject. For subcutaneous, I'm going to go into the abdomen. I'm going to go on the lateral thigh, upper lateral thigh, the upper hips, the upper back, and the upper lateral arm. For subcutaneous injections, I would use a 25 to 27 gauge needle, and I would go 1/2 to about 5/8 inch needle with that. And then for intramuscular, I'm going to find, for the deltoid, I'm going to find her chromium process, and go about 3 fingers, and inject into the deltoid muscle. For her ventral gluteal, I will find her, the top of her iliac crest, and her greater trochanter of the femur. I'm going to put my fingers, I'm going to make a V, and I'm going to inject for, that's for the ventrogluteal, and then I could twist my finger this way and inject it there for the dorsogluteal, and then I would again find the greater trochanter, the top of the iliac crest and the greater trochanter of the femur, and inject into the gluteal muscle. And then for the lateral thigh, this is the vastus lateralis, I'll find the greater trochanter of the femur and the patella, go about halfway and inject it to the side into that muscle. Okay, and then for intramuscular, I would use a 20 to 23 gauge needle with about 1 to 1.5 inch needle, and except for deltoid, I would do 23 to 25 gauge, 1 to 1.5 inch needle. Okay, so now I'm going to get my supplies. Since I'm looking at my MAR and I see I'm going to do a 0.5 milliliter sub-Q injection. So because I'm doing a 0.5 milliliter, I'm going to use my 1 milliliter syringe with my 1 milliliter syringe with my 25 to 27 gauge needle, and I'm going to do it from a vial. So I'm going to wash my hands, I'm going to put on my gloves. I'm going to put on my gloves. I'm going to put on the dummy needle onto my syringe, and I'm going to look at the vial and check for the expiration date, and it's good. So now I'm going to get an alcohol swab. I'm going to clean the top of the vial. Okay, I'm drawing at 0.5, so I'm going to get some air into my syringe. I'm going to inject the syringe into the vial, push the air in, I'll turn it around, and I'll draw up 0.5.
Good afternoon, Mr. Jones. I'm student nurse Landon.
I'm going to check for any air bubbles and release them. Okay. Get any excess out.
Could you verify your name and date of birth for me? Check your wristband.
Okay. And I drew 0.5 milliliters on my 1 milliliter syringe. Okay, and I'm going to recap my needle. I'm going to change back to my my subcutaneous needle, and now I'm going to take my gloves off, throw them away. I'm going to verbalize hand washing. I'm going to apply new gloves to get ready for my injection.
I did the same thing today.
Ready for my injection. I'm going to loosen the cap of my needle so it's ready. Okay. I'm going to get the alcohol swab. I'm going to swab the area. I'm going to get this in the left upper lateral arm. So I'm going to put that on, let it dry for a little while, and then I'm going to get ready for my injection. I'm going to take the needle off. I'm going to squeeze the muscle. So because it's a subcutaneous, I'm going to give it at a 45 angle injection, fast, and I would inject the medication. I would take it out, recap my needle. I would get my alcohol swab, and while I swab the alcohol, I'm also going to apply pressure to it for 2 in 1. And then that would be it. I'm going to discard my needles into the sharps container. I'm going to clean out my area. I'm going to take my gloves off, throw them away. I'm going to verbalize hand hygiene. And then I'm going to document on my MAR. I'm going to document, I'm going to do my initials, document that I gave it on the left upper arm. So I'm going to write 10, circle it. I'm going to sign the bottom and show what that these are my initials.
You look at the chromium.